Hey, want to pass the NCLEX? Well, let's walk through some key questions that you'll need to know. And if you want a ton of questions with rationales for free, simply click the link in the description below to create your free Simple Nursing account. All right, you future nurse, let's walk through this case study together. And remember, mentally highlight the key terms that risk safety. So, starting at the top. Step number 1 is read the intro and think safety. Always think of 3 things that can kill or harm this older adult client with a UTI. So before looking at the notes, think of 3 things that will kill or harm. Number 1 is confusion related to the infection. This is what's known as ALOC, altered level of consciousness. Number 2 is pyelonephritis, fancy words for a kidney infection. And number 3 is sepsis, that bloodborne infection. Now step number 2, let's look at the tabs and again, mentally highlight keywords that risk safety. So let's click on tab number 2. So we see gentamicin is 80 milligrams IV 3 times a day. So obviously this client is being treated for the infection. Now let's click over to tab number 3. Day 1 of hospitalization, we see that the UTI is not responding to oral antibiotics, showing a worsening infection, and the client's likely going to need IV antibiotics. The next thing is the fever. So obviously it requires management, as well as confusion. Remember, change in mental status is very concerning. We have to think potential sepsis. Now, the next key terms we have to take note of is dysuria, that difficulty urinating, urgency, flake pain, even bilateral CVA tenderness, as well as urine that is cloudy and dark, all indicators of possible pyelonephritis, fancy words for kidney infection. Now, let's click over to tab number 4. On day 1 of hospitalization at 9:15, we see a high temperature at 101.2. or 38.4 degrees Celsius. So this fever requires management. We also see a respiratory rate that is a little bit high at 24 breaths per minute. So the key point here is that confusion with respiratory rate greater than 22 breaths per minute are criteria for greater risk of sepsis. Now let's click over to tab number 5 for the UA results. So we see a bacteria count indicating infection. Also positive protein, leukocytes, and elevated RBCs and WBCs. So this indicates a major UTI. Now also BUN and creatinine are both high. BUN is 29 and creatinine is 1.5. Remember, anything over 1.3 is bad kidney for creatinine. And also remember, we have 2 kidney labs for 2 kidneys affected. So when BUN and creatinine are high, this means 2 kidneys are actually impaired. Now, step number 3, we always find the keywords before looking at each question or each item. So now that we've found each key term that risks safety, you can now go through each item more confidently when answering the specific questions. So remember, don't be scared, be prepared. Simply find each keyword that risks safety before jumping into the questions. So now let's jump into the first question. The question is asking to click to highlight the findings that require follow-up by the nurse. The problem is we have an older adult client with the UTI. So for the solution, before looking at the options, think of things that can kill or harm related to UTIs. So number 1, it can progress into a kidney infection known as pyelonephritis, and then potential sepsis, which is infection inside the blood. So now let's look at the information. So the first thing we're highlighting is the fever with occasional confusion. This is a huge finding associated with possible sepsis, as the infection migrates up to the brain since the infection is now in the blood. The next keywords we're highlighting is burning upon urination and flank pain. Obviously, huge key terms for infection. Also, the client states that they feel the need to urinate every 30 minutes. This shows urgency. And the next one here, positive CVA tenderness bilaterally. Fancy words for flank pain along the sides of the body. So this is possible pyelonephritis, where the kidneys are located. And the last big one here is a temperature of 101.2 degrees Fahrenheit, or 38.4 Celsius. Now this is a positive sign of infection and potential sepsis, which requires intervention. So this question is asking, for each assessment finding below, click to specify if it indicates pyelonephritis, renal calculi, or benign prostatic hyperplasia, that BPH. Now, each finding may support more than one disease process. So the problem here is we see fever, confusion, dysuria, that difficulty urinating, urgency, and positive CVA tenderness. Fancy words for flank pain. Now for the solution. Before looking at the options, think about the signs and symptoms of each. Well, in pyelonephritis, that kidney infection, it's like a UTI, but only worse. So we do see CVA tenderness, or basically flank pain, that is dull pain. Now, in terms of renal calculi, this is simply fancy words for kidney stones, and we see sharp stabbing pain in the flank. And lastly, for BPH, think of that big prostate that holds back urine. So we're going to see urinary retention, frequency, and even urgency. So now let's look at the chart here. Starting with pyelonephritis, the assessment finding is fever. So yes, let the name help you. Itis typically means infection. So pyelonephritis, we have a kidney infection. What about dysuria, that difficulty urinating? Well, yes, this is a sign and symptom of UTI, but only worse. So it applies for pyelonephritis. How about bacteriuria? Well, this is simply positive bacteria in the urine. So yes, another key finding. What about flank pain? Well, yes, of course. Dull flank pain that extends toward the belly button. And how about the last one here? Urinary frequency. Of course. Any type of infection in the bladder or the urinary tract, we see urinary frequency. Now moving on to renal calculi. Fancy words for a kidney stone. Are we going to see a fever here? Well, actually, yes, because those blockages from the stones can lead to a build of bacteria, causing an infection. What about dysuria, that difficulty urinating? Of course. Stones can lodge in the ureters, those tubes that go from the kidneys down to the bladder, causing painful urination. How about bacteria in the urine? Well, in this case, no. We don't see it all the time, and it's not indicative of a kidney stone. Now, what about flank pain? Well, yes, this may cause intense, sharp, stabbing pain that comes in waves and radiates towards the groin. Now, the last one is urinary frequency, because simply think about it. You have stones inside the kidneys, and we want to get that stone out of the body and into the potty. So the body's trying to frequently urinate. Now, lastly, what about BPH, that big prostate that holds back urine? Well, there's no infection, so we're not going to see a fever. Also, we're not going to see difficulty urinating, only difficulty starting a stream. What about bacteria in the urine? Well, once again, there's no infection, so we're not going to see bacteria in the urine. How about flank pain? No, simply think about the patho here. It's a big prostate that holds back urine, and it has nothing to do with the sides of the body here. Okay, now finally, what about urinary frequency? Well, yes, this is the only correct option, because remember, in BPH, we have a big prostate that holds back urine, which causes increased frequency. Hey, you, over there. Yeah, you. Check out our brand new NCLEX prep by simply clicking the link in the description below. In this question, we simply have to drag words from the choices below to fill in each blank in the sentence. So the problem here, we have to identify the potential complications of pyelonephritis, that kidney infection. So for the solution, before looking at the options, what can kill or harm this client with pyelonephritis? Well, number one is sepsis, that blood-borne infection. And number two could be acute kidney failure. So now let's look at the question here. The client is at highest risk for developing blank, as evidenced by blank and blank. So starting with the condition first, the client is at highest risk for developing blank. Again, think what can kill the client. Would it be sepsis? Well, yes, this is the biggest safety risk. Worsening infection can lead to sepsis, which is that blood-borne infection all around the body. Now, the rest of the options are incorrect, and let me explain why. Pneumonia is infection inside the lungs. Now, the client would have decreased lung sounds, but again, it's not the biggest risk related to a kidney infection. And the last one here, urinary incontinence, is not life-threatening, so this would not kill the client. So again, the client is at highest risk for developing sepsis, as evidenced by blank and blank. The biggest thing on the NCLEX is mental status changes. Remember, any sudden change in mental status can indicate a worsening condition, in this case, infection. So that is the correct answer. The other options are wrong, and let me show you why. Breath sounds is wrong because that's a risk for atelectasis, but doesn't really relate to a kidney infection. Neither does blood pressure. The current blood pressure is normal, but hypotension would suggest sepsis. Now for the next client finding. Would it be flank pain? Well, this finding is associated with pyelonephritis, but it's not really specific for sepsis. Neither is color of urine. So we see dark urine with pyelonephritis, but again, it's not a big indicator for sepsis. What about the respiratory rate? Well, yes, change in level of consciousness and even tachypnea is actually criteria that indicates a high risk for sepsis. So again, write it down. Change in LOC and tachypnea, big criteria for sepsis. So the correct answer is the client is at highest risk for developing sepsis, as evidenced by mental status changes and respiratory rate. In this question, it's asking us to identify which of the following interventions are appropriate to the client's condition, and it's a select all that apply question. The problem here is interventions for pyelonephritis. So for the solution, before looking at the options, what do you think is priority in terms of interventions for a kidney infection? Well, number one, we have to monitor the vital signs, but especially the level of consciousness. Number two is cultures first with blood and urine, and then we give antibiotics. And then very lastly, we have to monitor labs, especially the kidney function labs, as well as WBCs, and increase fluids. So now let's look at the options here. So option one is correct. Check with the client for any drug allergies. Well, obviously, that is the safest consideration before giving any drugs, but especially antibiotics. The next option is also correct. Review the client's kidney function tests, because remember, gentamicin is nephrotoxic, fancy words for kidney toxic. So we need to make sure those kidneys are functioning well. Now, option three is also correct here, because obtaining peak and trough levels per pharmacy protocol ensures gentamicin levels are in therapeutic range. Remember, too high, the kidneys will die, and too low, bacteria grows. The next option is also correct because it helps protect the client. Remember, screening tools can help identify levels of risk for sepsis. And the next option is also correct here. Monitor the client for adverse effects of prescribed antibiotic therapy. Huge safety concern, so always reassess your client after giving any medication. Now, the last option was a little bit tricky, but it's incorrect. And let me explain why. Gentamicin, the hardcore antibiotic, does not affect the blood pressure, so it would be incorrect. In this question, we have to complete the following sentence by choosing from the list of options. The problem here are the HCP orders related to pyelonephritis. So for the solution, think about safety. First, we have to take cultures for the blood and urine first. We do this before administering antibiotics. And number two, we have to monitor labs, especially kidney function and WBCs, as well as increasing fluids. So now for the question itself. The nurse must first blank, followed by blank. All right, so think about safety here. The nurse must first, is it going to be obtain urine for culture and sensitivity? Well, yes, we have to take cultures first, because if we give antibiotics before collecting the specimen, well then it can skew the results. Now the rest of the options in this column are incorrect, because administering the prescribed antibiotic is not the first thing to do. We have to take the cultures first. And drawing the blood trough for gentamicin is incorrect, because we haven't even given the gentamicin yet. So now we know the nurse must first obtain the urine for culture and sensitivity, followed by blank. So will it be obtaining urine for analysis? No, we already collected the urine. So it's got to be option two here, administering prescribed gentamicin, because always remember, cultures comes first, followed by antibiotics. And the last option is incorrect, because drawing blood for a peak level is only to be done after you give antibiotics. So the correct answer here is the nurse must first obtain urine for culture and sensitivity, followed by administering the prescribed gentamicin. Oh, this next one is a SATA question. And you know what they say, SATA is just one letter away from Satan. In this question, we have to select 4 pieces of client data that indicate a positive client response to the plan of care. The problem here is tracking the improvement of pyelonephritis and potential sepsis. So for the solution, before you look at the options, how do you know that this infection is getting better? Well, in pyelonephritis, we see number 1, flank pain. So flank pain should be decreasing. Also, we should be seeing improved labs. So now let's look at the options here. And remember, what is getting better? Is it going to be BUN? Well, yes, the BUN has improved from 29 and it's down to 18, indicating a positive response. What about dysuria? Well, the client still has continued discomfort and it does not indicate improvement. How about creatinine? Well, now it's down to 1.2 and it was at 1.5. So this one is getting better. What about the flank pain? Well, the presence of flank pain would not be considered an improvement because the client still has it. How about the last two here? The temperature. Well, the temperature is still mildly elevated at 99.2, but it's down significantly from 101.2. And the level of consciousness is also correct, because previously the client was confused, and now they're AO times 4. This question's asking for each discharge topic below, click to specify the appropriate teaching to be given. And each topic may support more than one teaching point. So the problem here is that discharge teaching after a TURP, due to that benign prostatic hyperplasia, that BPH. So for the solution, before looking at the options, think about the important teaching for a TURP. Now, if you didn't know, a TURP is a surgical procedure, and it sends a big metal tube down the urethra to basically grind up the prostate and suck it out. So obviously, the client is going to have bloody urine for the first 24 hours, as well as small clots up to 36 hours after. But we have to report for signs and symptoms of infection. And always avoid constipation and straining, and no intercourse for about 6 weeks, since the client had major surgery down in the pelvic area. All right, now let's dive into the options here. So first is complication prevention. What are we going to include in the teaching points? So would it be eating fruits and vegetables daily? Well, yes, this actually helps promote GI motility and decreases constipation risk. So this would decrease pelvic pressure. What about drinking 4 glasses of water per day? No, that's far too low. We need to up those numbers, kid. So 8 glasses or more of water per day. How about stool softeners as directed? Yes, this helps to prevent straining after surgery. Now moving on to activity. Number 1 is lawn mowing allowed 2 days after discharge. No, we want the client to not strain at all. So we have to avoid any physical activity for a few weeks after surgery. What about the next one? Avoiding activity that causes strain on the bladder until cleared by the HCP. Yes, this is the safest thing to do. How about no sexual activity for about 4 to 6 weeks? Yes, avoiding sexual intercourse for several weeks ensures healing. Now moving on to urination. Are we going to advise the client to use the bathroom at the first urge to void? Well, yes, this actually decreases the risk for infection and chance of incontinence. How about notifying the surgeon if there's blood in the urine 1 week after the procedure? Yes, of course. Urine should begin to get clear within about 24 hours after surgery. So we expect bloody urine up to that 24-hour mark after surgery. Now the last option is correct, and let me explain why. This one was a little bit tricky, but monitoring for discomfort with urination for up to 1 month after the procedure, this could be indicative of a potential infection, so we should report this to the HCP. The only thing I like less than bow tie questions is bow tie pasta. I'm way more of a fettuccine type of guy. All right, now for the infamous bow tie questions. Let's make it simple and break it down. The question's asking us to complete the diagram by dragging the choices to identify, number 1, the condition, number 2, the actions to address the condition, or basically how to save the client's life, and then lastly, number 3, the parameters to monitor for to keep the client safe. So in terms of the problem here, let's look into the case study and find keywords that risk safety. So we see that the client returns for a follow-up visit 1 week after taking a really long antibiotic. But just let the name help you. The word sulfa is in this antibiotic, so we know sulfas can be very toxic, and she took it for a UTI. Now let's click under tab number 1 and see what else we find. Now in tab number 1 of the nurse's notes, we see number 1, a new onset of symptoms. We see urinary burning and frequency. Now to me, that sounds a lot like a UTI, so that's expected. We also see the client reporting itchiness of the skin without a rash. Now, that sounds like a negative response to a medication. Next, we see dark urine, and oh boy, this looks like toxic kidneys. Next is increasing fatigue. All right, now I'm definitely thinking toxicity. And we also see abdominal cramps, clay-colored stools. Now, it all started about 2 days ago, and the itching and fatigue have gotten far worse. The next thing we're looking at is yellowing of the eyes, not present several days ago. So this definitely looks like the liver is getting toxic, showing up as jaundice on the skin. So again, I'm thinking toxicity more than ever. Now let's click over to tab number 2. The blood pressure has increased just a little bit, and the temperature has increased into a fever, which is weird because the antibiotics should have killed the bacteria from that UTI. Okay, now for the solution. Before looking at the answer options, base everything on data. Simply think what kills or harms the client first. So as mentioned before, we have to think toxicity. As the question stated, number 1, itchy skin without a rash. Number 2 is that dark urine and clay-colored stools. And the last one here is the yellowing of the eyes, showing the liver is probably toxic. Okay, now let's look at the options here. So the first option is incorrect. An allergic reaction would show up with hives all over and even a rash on the skin, so we see itchy skin without a rash. Now the next option is incorrect because anaphylaxis is an extreme version of an allergic reaction. So we would see the lungs closing up and even hear wheezing, but we really don't see that here in the data. Now moving on to option 3, this one is also incorrect, but this one was really close because in tab number 2, the temperature is increased, showing the medication is probably not working. But this could also be due to the toxicity. Now, option 4 is correct. Drug-induced hepatitis. So again, let the name help you. Itis means inflammation or even infection, and hepat means the liver. So this mostly aligns with all the data shown in the tabs of the case study. The biggest thing that gave this one away is the yellowing of the eyes that shows liver toxicity from that jaundice, but also clay-colored stools, which may be due to the buildup of bile inside the body, as well as jaundice, the yellowing of the skin, often occurring with clay-colored stools. Now, in terms of the actions, before looking at the options, think about the data in the case study. Then think about actions that are going to save the client's life. So the labs confirm toxicity. And think about the ABCs of the liver. So A is for albumin. Remember, albumin attracts water and calcium, and without it, it leads to ascites, a big fluid-filled abdomen. Now, B is for bile, which I call the bile bus. It transports bilirubin, basically dead RBCs, out of the body and into the potty. With low bile, we can't transport those RBCs, and then they end up building up, reflecting on the skin as yellowing of the skin, noted as jaundice. And then C is for coagulation factors, huge bleed risk. So we have to assess PT and INR. Now, let's look at the options here. So option 1 is correct. We need a complete metabolic panel, or basically blood labs. It's going to give us an accurate look at what's going on in the liver. Now, option 2 is incorrect because the emergency room is not the best option, since the client is stable and really nothing's going to kill the client immediately. Now, if the client had difficulty breathing or is getting worse, then that would be an ABC issue. Now, option 3 is also incorrect, but this one was a little bit close because the high temperature in tab number 2. But before giving IV antibiotics, we have to check for the culture and sensitivity test first. Because remember, on the NCLEX, culture and sensitivity comes before giving more antibiotics. Now, option 4 is correct because anticipating the order of PT and INR is the best. Because remember, the liver makes coagulation factors. So a damaged or inflamed liver, we have a huge risk for bleeding. Okay, now let's move on to the parameters to monitor. So before looking at the options, think about the data in the case study. What do we want to monitor to keep the client safe? So now let's look at the options. Option 1 is correct. Since the liver is affected, we need to monitor the liver enzymes just to make sure it's not getting worse. Option 2 is incorrect. Now this one was a little bit close because the yellowing of the eyes, but there's no indication that the client has vision problems, only yellowing of the eyes, which is simply a liver issue. Option number 3 is also incorrect. Another close one because of the dark urine. But once again, the dark urine is likely to the buildup of dead RBCs, resulting in jaundice in the skin, and now dark urine. Now, what about option 4, daily weights? Well, this one is correct. Now, I know it sounds weird, but remember, the ABCs of the liver. A is for albumin, and remember, A for albumin, A attracts water. So it retains fluid inside the blood vessels. Now, since we don't have albumin here, well then all that water escapes the blood vessels and now goes into the third spacing, mainly into the abdomen, resulting in ascites. And so simply think weight gain equals water gain. Now what about option 5? This one is incorrect, but man, it was a close one. Remember, creatinine over 1.3 is bad kidney, but there's no lab data or even signs and symptoms that support kidney problems. All we have here is dark urine. So let's break down this question. For each finding, click to specify if it indicates a side effect, an allergy, or an overdose. The problem here is the newly prescribed Dutasteride for BPH, benign prostatic hyperplasia. So for the solution, before looking at the options, what do you know about this new medication, Dutasteride? So remember, with BPH, it's a big prostate that holds back urine. So I like to think of this medication as a ride on the back of a horse. So you're not going to have a fun ride with a big prostate. So take Dutasteride to have a fun ride. This is because it shrinks the prostate. So some common side effects is dizziness, fatigue, and even chills. So a big safety consideration. Women of childbearing age should not touch the tablets. All right, now let's look at the chart here. So a side effect to consider. Would it be chills? Well, yes. The medication blocks DHT, which affects temperature control and causes chills. What about fatigue? Well, yes, it affects energy expenditures and even increases fatigue. And the last three we're not going to choose because it doesn't cause blistering of the skin. Only one tablet remaining for the next 7 days has nothing to do with the side effect, so that one's incorrect. And swelling of the face is completely incorrect. Now moving on to the second column for allergies. We wouldn't see chills or even fatigue. That's not typical for an allergic reaction. But we would see blistering of the skin. And the next one is incorrect because only one tablet remaining for 7 days is not an allergic response. But swelling of the face is. This finding is indicative of anaphylaxis. Now let's move over to overdose. So we're not going to see chills and we're not going to see fatigue. We won't even see blistering of the skin. The key term here is that the client states that they only have one tablet remaining for the next 7 days. So we have insufficient quantity. Big red flag for the client taking too many medications at one time for potential overdose. And the last option is incorrect because swelling of the face is not typical with an overdose. Now on to the final question. But first, if you want more NGN rationales just like this, click the link in the description below. This question is asking to select 3 clinical manifestations, or basically signs and symptoms, that confirm the presence of penile prosthesis infection. So the problem here is the infected penile prosthesis. So for the solution, before looking at the options, think about the signs and symptoms of an infection, especially related to penile prosthesis. Well, with any infection on the NCLEX, we're going to see fever, redness, swelling, even purulent discharge that has malodor. Also increased pain at the surgical site. Now let's look at the clinical manifestations. So oral temperature is 101 degrees Fahrenheit. Well, yes, increased temperature is a positive sign for an infection. What about penile redness and even swelling? Well, yes, erythema is a sign and symptom of infection. What about the next one? Persistent upper back pain. Well, no, this one's incorrect. We would expect increased pain at the surgical site, not in the back. How about purulent penile discharge? Ooh, it sounds gross. Well, yes, purulent penile discharge is indicative of an infection. And the last one is incorrect here. Heart rate at 55 beats per minute. We would expect tachycardia in the presence of the infection. Wow, NGN questions are no joke, but you're doing great. Get access to way more NGN questions, plus all of this. And you can sign up for free by simply clicking the link in the description below.